Hello.
All right, we're all set. This video is being made on request of Ziv Tamir because being a survivor of back pain many, many years ago, and I came down to Miami Beach last May approximately and found Ziv kind of bent over backwards in a bad shape, walking with a limp. And I asked him, "What's the matter with you?" And he says, "I have a terrible back. I twisted my back. I bent wrong. I did this. I did that. And I'm in pain and I'm not functioning very well." So which I replied, I remember myself in the exact same position when I was about your age. And as I said, I was in my 30s and I had 3 children and I had 3 tuition bills to pay and 3 sleepaway camp bills to pay. And I was running a growing business and I had 12 payrolls or 15 payrolls to make at the time. And all of a sudden, my back goes out. It goes out to the point that I couldn't function. I couldn't sit. I had to stand up and stretch. The pain was in the lower back. The pain was in the tuchus. The pain right down my leg. The pain was everywhere. And I was a responsible human being. I had to get to work. I had to do things. I couldn't live with this. So of course, you run from doctor to doctor to doctor to doctor. The doctor helped me get me out of pains. And eventually, you found your way to chiropractors, and regular doctors didn't do it. Osteopaths, pain management doctors. Eventually, it was a neurologist in NYU who gave me looked at my CAT. Of course, you go for CAT scans and MRIs, all of which kind of show a herniated disc, and that's what's causing the pain. Everybody makes the same diagnosis. And the neurologist gives you a little catch over here with the foot and a hammer, boom, 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 on the other side too, and scheduled me for surgery for the following week. And here I was scheduled for surgery, and I go home that day, and things just got worse after having seen that doctor. Make a long story short, I never went for the surgery because I was afraid of having surgery. I don't like doctors anyway, much less surgery. And eventually found my way, but the wrong way, because somebody told me, "Did you ever hear of Dr. Sarno? Dr. Sarno will explain to you that it's all in the head." And I keep saying, it's not in the head. The pain is very, very real. It's not in the head. So she did not explain to me correctly what Dr. Sarno was all about, but I found my way to Dr. Sarno. At that time, he was a practicing physician at the Rusk Institute of Rehabilitative Medicine, part of NYU downtown on 31st Street and 1st Avenue. He saw me and I gave him my MRI, I gave him my CAT scan, I gave him x-rays, I gave him everything that I had, and he kind of went, okay. And I says, well, he said, "I see no structural damage in your back, so you are officially now my patient, and we'll get started. You'll come to my lectures beginning, give me a date, a week later. In the meantime, don't think about your back. Stop, he said, look, part of the lecture also explains, look at a Sunday football game. And you see a guy 300 pounds tackling a guy 200 pounds, and he's running at full speed, and they're both running at full speed, and the 200-pound guy gets up and walks away. So to say that you twisted your back by bending down tying your shoelaces is kind of absurd. A back can take a lot more abuse than that. And through his lectures and working with a physical therapist of his choosing that works with his program, he explained that the disease is known as TMS. He calls it tension myositis syndrome, which has to do with the autonomic nervous system of the body, which is the same nervous system that controls things like breathing, what you don't think about, or blinking when somebody throws a ball at your eye. You don't consciously think about those things, but they happen constantly within the body. There's an autonomic nervous system of the body that protects the body. He says, when you are, not tension, again, a bad word, anxiety. Life has anxiety. You're a responsible human being. You have anxiety. You have to go to work. You have tuitions to pay. You have expenses. You have a business to run. You are a responsible human being. That gives you anxiety. You're an anxious person. The bum who sits in the Bowery drinking his Thunderbird on a stoop doesn't have anxiety. He has no back pain. And he explained that the disease has a correlative factor. Once you know what's wrong, you stop doing it to yourself. Similarly, everybody correlates drip, drip, drip of acid in the stomach to ulcers. Eventually, once you have that correlation, the body no longer drips, drip, drips the acid. You eliminate the ulcers. So the correlation has to be made between your back pain, whether it's in the lower back, radiate through the butt, all the way down the legs, wherever it is, because it's sciatic nerve. It starts in the lower back. The autonomic nervous system contracts the weakest muscles of the body and by eliminating its blood flow. It's giving you something else to think about rather than what you're anxious about, basically. Now, you think you got troubles with a business to run and everything else to do, Forget about that. You're in trouble. You got back pain. Take care of this. So the body is protecting you really by doing this. And the trick is knowing what it is, opening up those muscles, taking the pressure off the sciatic nerve. When that's off, the rest of the body kind of goes easy. And this program works throughout your life. I explained to Ziv that I was in Hong Kong once, and I got off the bus on a Sunday, couldn't get off that bus. I was 10,000 miles away from my office. I was in contact by fax and email to my office, knowing what's going on, and I was helpless not being able to do anything for it. All that's in my head for a half-hour bus ride going from Central to Stanley.